Okay, for the musculoskeletal assessment, let's start with the structures and functions. Yan, the skeleton is the bony framework of the body. So ano yung framework? Ibig sabihin, ito yung nagbibigay ng structure, no? Parang sa building, parang ito yung mga bakal-bakal na nakikita natin. So wala siyang magiging form, ang katawan natin walang magiging form unless meron kang skeleton. So because of her skeleton, kaya nga 'di ba merong mga bony features, meron kang makikita ng mga pangahan or merong mga cheekbone, that is because of our bony framework. So the bone and the cartilage are specialized forms of connective tissue. Kapag dinescribe natin ang bone is hard, rigid, and very dense. Bone is hard, rigid, and very dense. The joints and articulations are places of union. So ito yung dugtong-dugtong. Kapag yung joints, ibig sabihin nito, these are the places of union of two or more bones. Imagine mo ang iyong tuhod, no? Ang tuhod hindi naman siya isang one skeleton lang or one bone lang siya. Meron siyang pinagdugtong. So, ang tawag doon, yung places of union, those are our joints or our articulations. Look at the screen, class, and take note of this one. Kasi ito ang first activity natin for finals. Yan. Maglagay kayo sa inyong notebook, sa inyong logbook, no? This one. Lalagyan nyo to. Huwag nyo nang i-drawing kasi hindi ko naman nakipag-drawing. Maglagay lang kayo doon ng yung mga parts natin, no? This one is the cranium, the mandible, pero isang page, no? Maglagay kayo ng the skeletal framework natin. Print kayo doon. The cranium, the mandible, that is your jaw, the clavicle, and reviewin nyo na kasi magkakaroon tayo ng quiz. Tatanggalin ko itong mga pangalan na to and you will be identifying them. Alam nyo, maganda, hindi nyo kasi siya na-experience sana, no? Pero ng anatomy, talagang every part, every bone talaga yan ay ni-review ng aming teacher that time. At talagang ang gagawin sana natin, kung tayo ay nasa face-to-face class, kada upuan, merong picture yan ng bone. For example, this one, may isang picture yan. I-identify mo, is this the ulna? Tapos, after 1 minute, lilipat ka ng upuan. I-identify mo anong pangalan nito, that is the cranium. Maganda sana ma-experience natin yun. But, siguro sa next sem, magkakaroon tayo ng, hopefully, no? Magkakaroon na tayo ng face-to-face classes. And, I think yung finals examination din natin, baka i-push na magkaroon din tayo ng live exam, physical exam, face-to-face examination. So this is your clavicle, no? Your clavicle, and then your scapula, your sternum, your ribs, your humerus, this one, yung arms mo, and then your ilium, this one, yung nararamdaman mo dito sa taas ng iyong singit, no? Merong para dyang bony structure, that is your ilium, your radius, your ulna, no? And then the femur, the patella, the tibia, the fibula, the tarsals, the metatarsals, the phalanges. The phalanges, those are your fingers, no? So take note of this one and review the parts. No, mas maganda kung ilalagay mo na siya sa iyong notebook. Habang nilalagay mo, paste mo doon sa iyong logbook. Kasi check natin yan after ng finals. Ipapasa nyo sa akin ang inyong logbook and this is one of your requirements and I will be checking your activities. So bago mo i-paste doon, maganda, i-review mo na siya. This one is the cranium, the mandible, the sternum. Be creative as you can be. I'm not requiring you to draw, pero kung marunong ka naman at kaya mong i-drawing, why not, no? Baka mas maganda pa yung pagkakagawa mo kung drawing. But yun, I want to see this one. Okay, take note of that. This one is to be passed after before our final exams. So meron pa tayong ilang weeks para kumpletuhin nyo ang inyong mga activities sa inyong logbook. Okay, what are the musculoskeletal components? Isa-isahin na lang natin. You have your non-synovial joints, synovial joints, the muscles, the temporosmandibular joint, your spine, your shoulder, your elbow, your wrist, your carpals, your hip, your knee, and your ankle. Ankle, not uncle. Ankle. The non-synovial joints, these are the bones united by fibrous tissue or cartilage. There are two types. You have your immovable. For example, the sutures in the skull. Alam nyo ba na ang skull natin hindi lang siya isang kumbaga isang component na no, meron yan. If you will be checking, parang merong mga sutures ano, these are lines na pinagbuo-buo, so hindi lang siya isang buong yung skull natin, yung bungo natin, hindi lang siya isang kumbaga parang bola na isang ano lang siya no, isang solid form. Meron tayong mga fibrous tissue or meron din tayong mga sutures in skull, but this one hindi siya nagagalaw. So hindi siya dapat naghihiwa-hiwalay unless meron kang trauma, may injury, meron kang nagkaroon ng accident, saka lang baka magkaroon ng moving. But for example, your vertebrae, yung nasa likod mo, no? Nasa likuran natin ng ating spine, these are slightly movable. Bakit? Kasi nakakapag-bend tayo, nakakapaggalaw tayo, nakakasayaw tayo. So these are supposed to move. But this one, as an example, they do not move. These are the synovial joints. The synovial joints, they move freely because bones separated and enclosed in joint cavity. The cavity is filled with lubricant or synovial fluid. The lubricant is what we call the synovial fluid. The synovial fluid, it helps or it allows the sliding. Bakit kapag tumakbo ka ay hindi nagkakalansingan yung iyong mga buto? Pero minsan mapapansin mo, bakit kapag nag-stretching ka, bakit kapag meron kang biglang kinuha, parang tumutunog yung buto mo, no? But this one, the synovial fluid, it allows the sliding. It permits the movement because of the synovial fluid. That's why ang tawag din dito is the synovial joints. It is the layer of resilient cartilage cover surface of opposing bones. It receives nourishment from synovial fluid. The cartilage cushions bones and gives smooth surface to facilitate movement. Imaginein mo kung hindi yan smooth at kung pointed siya, no? Imaginein mo yung kapag kumain ka ng native naman ako, no? Masyado silang mga matutusok. Pero ang galing na pagkaka-design sa atin na this one is it has a smooth surface to facilitate movement. But it is a smooth surface, but it has tough, firm consistency, but it is also flexible. The synovial joints, these are joints surrounded by fibrous capsule and supported by ligaments. The ligaments are fibrous bands running directly from one bone to another. It strengthens the joints and help prevent movement. So what helps prevent movement in undesirable directions? These are the synovial joints. So ang synovial joints natin, it move freely because bones separated and enclosed in joint cavity. The synovial fluid, what allows sliding, which one allows or permits movement, that is the synovial fluid. The synovial fluid allows the sliding, which permits movement. Synovial fluid. So paulit-ulit tayo. Let's go to muscles. Did you know that our muscles account for 40% to 50% of body's weight? Yan. Depende kung ikaw ba ay more muscular or mas marami kang fats, no, sa katawan. When they contract, they produce movement. Muscles are of three types. What are the three types of muscles? Take note of this. You have your skeletal, you have your smooth muscle, and you have your cardiac. What are the three types of muscles? Skeletal, smooth, and cardiac. The skeletal or voluntary muscles are under conscious control. So ikaw ang nagpapagalaw nito. Each skeletal muscle is composed of bundles of muscle fibers or fasciculi. Muscle fibers or fasciculi. The skeletal muscle is attached to the bone by tendon or a strong fibrous cord. Tendon is a strong fibrous cord. This is the skeletal muscle, saan siya naka-attach, nakadikit siya mismo sa bone. Nakadikit siya sa bone, naka-attach siya sa bone by the tendon. The tendon is the strong fibrous cord. Yan. The skeletal muscle. The skeletal muscle produces the following movements. Yan. After this one, meron tayong picture na titingnan. Flexion, extension. Para tayong magpipi'i dito kasi pag-aaralan natin yung mga movements. The flexion, the extension, the flexion, and then the extension. Abduction, adduction, external rotation, internal rotation, rotation, pronation, supination, inversion, eversion. Punta tayo dyan. Yan. Tanggalin ko ang aking background para mas makita ninyo. Yan. Okay. Sige. Pwede nyo akong sundan, class. Flexion. This one is the flexion. Para maalala mo din yung mga movements. Isang way din ng pagre-review mo, kung meron kang mga kailangan review, meron pa kayong PE, tama? One way of reviewing is you look at the mirror, i-recite mo siya. At isa pang one way of memorizing is you doing it yourself. So for example, flexion. Paano mo matatandaan ang flexion? Flexion is like this. So pwede nyo ako sundan. Flexion, extension. Flexion, extension. Abduction. Abduction is pa-away, no? Pataas, no? From your side, and abduction. Abduction, from the word abduction, may kinuha, so papaalis. Away. Abduction. Adduction ay pabalik. Okay? So, pwede tayo magkaroon ng ano dyan, mag-recitation tayo. Show me what is flexion. Flexion, extension. Bakit kailangan natin yung mga movements na to? Kasi magagamit natin to until 4th year, yung mga tawag dito, mga movements na to. Until 4th year, magagamit po natin yan. Kaya pinag-aaralan natin ngayon. Flexion, the extension of arms, the abduction, and then the adduction. Pronation, supination, pronation, supination, circumduction, gagawa ka ng circle, circumduction. And then the eversion, for example, this is your feet. Eversion is, eversion, for example, this one, itataas mo siya. For example, this is your left foot. Hindi ko napapakita ako, no? If, for example, this is your left foot. Eversion is yung nasa labas, yung nasa gilid, itataas mo siya. But yung inversion, ang itataas mo naman kung ano ang nasa middle, no? So yung thumb mo ay yung toe finger na pinakamalaki mo, no? So that is the inversion. Eversion and then inversion. Protraction. Protraction is you will be parang yung sumasayaw na no? Protraction is you moving your head na forward. Protraction, and then retraction, you will be tilting or moving your head backward. Protraction and then retraction. Rotation, gagalawin mo naman ang iyong ulo. Elevation. Elevation is you, for example, elevation of the shoulders, no? Sinabi sa'yo ng prof mo or ng doctor, no? There is elevation of the shoulders. Ano ibig sabihin nun? Elevation is pagtaas ng kanyang shoulders. Naka-elevate ang kanyang elevation of the left shoulder or elevation of the right shoulder. And pag sinabi namang depression, merong 2 types ng depression na. Yung depression na nalulungkot or sobrang kalungkutan na hindi mo alam kung ano ang pinagdadaanan mo. Hindi yun ang pinag-uusapan natin. Ano? Depression is pagbaba. No? Elevation, pagtaas, and then depression. So these are some of the skeletal muscle movements. So pag-aralan ninyo ito, class, kasi magkakaroon tayo ng recitation dito. Show me what flexion is, extension, abduction, adduction, pronation, supination, circumduction, eversion, inversion, rotation, protraction, retraction, elevation, and depression. So those are some of your skeletal muscle movement. Yan. Ito yung definition natin kanina. Let's go to the spine and the vertebrae. The spine and the Spine and vertebrae. The vertebrae are 33 connecting bones stuck in vertical column. So, vertebrae, para hindi ka malito, vertebrae is vertical. Of course, no? Vertical is pataas. Wala namang skeletal, wala namang vertebrae or skeletal bones na horizontal unless nakahiga ka. So, horizontal, pahalang. Pero ang ating vertebrae, vertical, pataas. Ikaw ay upright position. You can feel the spinous processes in furrow down midline of back. Mararamdaman mo yun eh. Salatin mo ngayon ng iyong likod, no? Unless meron kang talagang medyo fat ang iyong likod, no? Hindi kahit na medyo mataba class, mararamdaman mo pa rin yung parang buto mo eh, no? Yung parang dugtungan na ganun. Mararamdaman mo pa rin merong kang spinous process dyan. The vertebrae in humans, take note of this. You have 7 cervical here. Isa-isahin natin, ano? You have 33 here. The first 7 is the cervical, no? This one, the cervical. From the C1 to C7. Yan, cervical. And then you have your thoracic. Para mas madali mong matandaan, yung thoracic, nilagyan siya ng letter T at nilagyan siya ng 1. So from T1 to T12, that is the thoracic. And then after nun, pupunta na tayo sa L. Kasi L because lumbar na, lumbar region or yung lower back na siya. L1 to L5. And then you have the sacral, you have 5 again. S1, S2, S3, S4, S5. And then you have your coccyx or your tailbone. Ito na yung, pag nakaupo kayo class ngayon, for example, nakaupo kayo ngayon, di ba ang iyong buttocks, yung iyong puwitan, meron kang mararamdaman na parang bony structure sa gitna ng iyong buttocks area. Yung parang mararamdaman mo siya na minsan kasi, I don't know kung na-experience yun eh, kapag sobrang tagal mong nakaupo, mararamdaman mo parang nangangala yung buto mo dito. Hindi yung balakang yung buto mo sa gilid. Lalo na kung yung iba ay merong, tawag dito, merong scoliosis or masyadong, for example, overweight, naging overweight ka na rin, na nahihirapan ng iyong tailbone. Or kapag ikaw naman ay nasaldak or bigla kang napaupo or bigla kang nadulas at bigla mong naisaldak ang iyong pitan, ang tumatama doon ng iyong tailbone. Ito yun, yung coccyx. Okay, so the vertebrae, you have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and then 3 to 4 coccygeal. 7, 12, 5, 5, 3. 7, 12, 5, 5, 3, cervical, thoracic, lumbar, and sacral. You have your spine landmarks. Binibilisan lang natin kasi this is actually a review from your anatomy. The spine landmarks, you have your spinous processes of C7 and T1. These are prominent at the base of the neck. The inferior angle of scapula, ito, lalagyan lang natin ng definition from here, no? Ito kasi pinakita lang yung cervical, thoracic, lumbar, and sacral. Here, between the T7 and T8, ito yung inferior angle of scapula, normally at the level of interspace. You have your imaginary line connecting highest point on each iliac crest crosses the L4 here, and then the imaginary line joining two symmetric dimples that overlie posterior superior iliac spines crosses the sacrum. Some they have yung kapag tiningnan yung kanilang likuran, meron silang parang dimples, yung merong dimpling area na merong dimpling dito sa kanilang posterior superior iliac spine. So yan, meron silang dimpling dyan. And this is the lateral view. Okay, the lateral view shows vertebral column has 4 curves and a double S shape. So S, no? Gumawa ka ng isang S, tapos gumawa ka pa ng isang S. This is the lateral view. The cervical and lumbar curves are concave, inward, and or anterior. So pag dinefine mo ang cervical na curve, So cervical, thoracic, lumbar, yun ang sunod-sunod, di ba? The cervical, pa-inward. So imagine, hindi siya, pag tinignan mo siya dito class, sa gilid, hindi siya straight na straight. No, ma'am, akala ko po ba vertical, pataas? Yes, pataas, pero hindi siya yung very straight. No, hindi siya as straight as makikita natin. Okay, so cervical curve has an inward. So this one, inward. And then the thoracic, pagpunta naman ng thoracic, ito na yung area ng ating back, no? Ang thoracic naman, meron naman siyang outward. Normal lang na kapag tumalikod ka, yung thoracic curve, hindi naman siya yung straight lang talaga, no? Meron siyang normal na curvature. The thoracic and sacrococcygeal curves are convex. Convex is like this. Convex is like outward, no? Para kang nagkaroon ng concave, it's like gumagawa ka ng, it's not inward, this one is outward. Okay, balance or compensatory nature of curves together with intervertebral disc allows spine to absorb the shock. Intervertebral discs are elastic, fibrocartilaginous plates that constitute 1/4 the length of column. So, ibig sabihin ito, itong balance or compensatory nature of the curves that we have, hindi siya very straight, ano? This is designed para kapag ikaw ay tumatalon, ikaw ay tumatakbo, merong na-absorb yung shock ng gravity. Kasi kung siya ay straight na straight ang ating buto, hindi niya ma-absorb yung bigat ng katawan, hindi rin niya mabubuhat ang ating weight. And kapag ikaw ay tumalon or kapag ikaw ay tumalon, tumatakbo, or bigla kang may binuhat na mabigat, yung pagdala ng weight ay hindi ganoon kaganda kung unless na meron talagang normal na curvature. So this is designed to allow the spine to absorb the shock. Kaya ganito ang pagkaka-design sa atin. Hindi siya very straight. This is to absorb the shock done when you are moving, when you are running, and when you are having strenuous movements. The spine and the vertebrae. So here, as you can see, each disc center has nucleus pulposus made of soft semi-fluid mucoid material. So when you open this one, inside, yan, each disc ang tawag natin dito, meron kang makikita na soft semi-fluid mucoid material. This is the nucleus pulposus. The disc cushion spine like shock absorber. So, inulit natin, ano, these are shock absorber. Imaginein mo yung may laruan tayo ng bata na yung gumaganon. Yung kapag, yung para siyang, imagine yun, kalimutan ko yung tawag doon. So parang ganun ang ating, meron siyang disc cushion that it is absorbing the shock and it helps us move. As spine moves, elasticity of disc allows compression on one side with compensatory expansion on other. Motions of vertebral column are flexion. So what are the movements? You have bending forward, di ba? Ikaw, kaya mo, you can touch your toes. Kaya mo ba yon? Kaya mo bang mag-bend forward and touch your toes? You can either bend back kasi yung iba, di ba, kayang mag-tumbling or kayang maglakad ng, parang exorcist, no? Extension, bending back. These are all possible because of our spine and our vertebrae. And you have your abduction. Abduction is either pataas or rotation. Okay. The temporomandibular joint, we will go now sa ating facial features. Now, the articulation of mandible and the temporal bone. You can feel it in depression anterior to tragus of the ear. The TMJ permits jaw function of speaking and chewing. So the temporomandibular joint, this is the temporomandibular joint. Makikita natin siya, meron kang makikita na depression or parang depression or meron kang slight na makikita na parang paglubog, no? Anterior to the tragus of the ear. This is allowing you, the TMJ or the temporomandibular joint, this allows you to speak Kaya mo nagagalaw, kaya ka nakakapagsalita because of the joint that you have here, the temporomandibular joint. Kaya ka nakakapagsalita, nagagalaw mo ang iyong bibig, na-open and naka-close mo ang iyong bibig, at nakakakain ka, nakaka-chew ka. So these are the three motions. It allows three motion. The hinge action to open and close jaws. So these are the motions of the TMJ. TMJ here, no? Bakit kaya mong ibukas? Bakit kaya mong magsalita? No? Because of the temporomandibular joint. It glides action for protrusion and retraction. It glides side-to-side movement or lower jaw. No? Kaya mo siya. Minsan na mapapansin hindi ko alam kung kaya mapapansin nyo, kapag ginalaw mo ang iyong bibig, minsan meron kang mararamdaman na parang slight na parang tunog or parang yung iba kasi nagkakaroon ng condition na tinatawag na lockjaw, no? Dahil yung, for example, last time noon, kaya ako nagkaroon ng braces kasi sabi ng doktor, meron akong problema sa TMJ. So, kinailangan akong i-brace ang aking ipin para i-realign ang aking panga, no, ang temporomandibular joint. So what are the three motions? It hinge action to open and close jaws, and glides action for protrusion and retraction, and it glides for side-to-side movement. Yan. Lapit na tayo. The shoulders, shoulders, you have your glenohumeral joint. This is the articulation of humerus with glenoid fossa of the scapula. These are the ball and socket. The ball and socket action allows movement of arm or many axes. Yan. The ball and the socket. This one is the ball and this one is the socket. Yan. The rotator cuff are the group of four muscles and tendons support and stabilize the shoulders. Your elbow it also allows your movement. The elbow joint contains three bony articulations. The humerus is the upper part, the humerus, the radius, and then the ulna. The radius and then the ulna. The hinge action moves forearm on one plane and allowing flexion and extension. The palpable landmarks are medial and lateral epicondyles of humerus and large olecranon processes of ulna between them. The radius and ulna articulate with each other at two radio-ulnar joints, one at elbow and one at the wrist. It permits pronation and supination of hand and the forearm. Kaya natin nagagalaw because of the humerus and the connection of the radius and then the ulna. Your wrist and your carpals. Yan, galawin natin nga ang ating wrist and carpals. Your wrist or your radiocarpal joint. This is your movement is permissible because of this one. The articulation of radius on thumb side and the row of carpal bones. The condyloid action permits movement in two planes at right angles, the flexion, extension, and side-to-side movement. So you can move, sige nga, mag-exercise nga kayo dyan. You can side-to-side movement and then upward and forward and upward and backward, and then the flexion, no? Kaya mong mag-close open, kaya mong mag-rotate. Yan, because of our joints here, the radiocarpal joint. The midcarpal joint allows flexion, extension, and some rotation. The metacarpophalangeal and interphalangeal joints permit finger flexion and extension. Yan. Bakit nagagalaw din natin ang ating mga fingers? Because those fingers, those phalanges, they also have their own joints. The flexor tendons of wrist and hand enclosed in synovial sheaths. Your hip bone, you have the articulation between the acetabulum and head of the femur. The ball and socket action permits wide range of motion on many axes. Less range of motion than shoulder, but more stability for weight-bearing function. Yan. Kung iko-kumpara ang ating shoulders, kumpara sa ating hip, meron din kasi siyang, parehas siya na gumagalaw, no? Parehas din siya na yung extremities. This is your upper extremities and this is your lower. Your lower, it consists of your hip downward, no? Your hip, it has less range of motion. Hindi siya mas magagalaw kagaya ng iyong kamay, ng iyong upper, but the stability for weight bearing, ito ang nagdadala ng ating weight. Yan, ang ating hips. Hip stability is due to powerful muscles that spread over joint. Kaya nga, di ba, meron tayong mga exercises na squatting, meron tayong mga exercises na ganyan, strong fibrous articular capsule, and deep insertion of head of femur. You have three bursae facilitate movement. Your knees, your knee joint, the femur, the tibia, and the patella. The patella is your kneecap. Yan. Yung nahahawakan mo dyan na minsan kapag natunggol mo ay parang masakit. That is the kneecap. This is the common articular cavity. What is the largest joint in the body? That is your knee. The largest joint in your body is your knee. The hinge joint permitting flexion and extension of lower leg on single plane. The synovial membrane is the largest in body, forms sac at superior border of patella, suprapatellar pouch, and so on. You also have your knee landmarks. The knee stabilized by two sets of ligaments. It cruciate, give anterior and posterior stability, and help control rotation. So, ang ibig sabihin lang nito, ang ating knees, meron din siyang ability to rotate, to extend, to flex because of the ligaments that you have here. Your ankle and your foot. Kung nagagalaw natin ang ating wrist, ang ating carpus, ang ating metacarpus, ang ating phalanges, nagagalaw din natin ang ating ankle at ng ating foot. Sige nga, galawin nyo nga dyan, paikot-ikutin nyo nga para na-exercise. I-vert and invert nyo nga and then rotate. So those are the ankle or the tibiotalar joint, articulation of tibia, fibula, and the talus. Hinge joint is limited to flexion, dorsiflexion, and extension in one plane. Pansinin mo, yung paa, kaya mo siyang i-flex, pero hindi mo siya todong kayang tawag dito, flexion and eversion. Unlike your hands, no? Kaya mo siyang i-flex and then i-extend. Unlike your feet, kaya mo siyang i-extend pero not to the extent na kaya mo siyang ibaling ng kagaya ng movement ng iyong wrist. Meron din siyang some limitations. Yan. The landmarks are two bony prominences or on either side. So meron kang mararamdaman dyan na mga mararamdaman na buto sa iyong mga paa. Yan. So your landmarks are two bony prominences on either side, the medial and the malleolus and the lateral malleolus. These are strong, tight medial lateral ligaments extend from each malleolus onto foot to help lateral stability of ankle. It may be torn in eversion or inversion sprains of ankle. Ano ibig sabihin nito? Usually dahil ang ating legs, ang ating paa ang nagdadala ng ating weight. At kung tayo ay overweight or kung masyadong overwork, takbo ka ng takbo, lakad ka ng lakad, minsan nagkakaroon ng tearing or natutorn ang muscles, nagkakaroon ng sprain. So these are parts na usually nagkakaroon ng mga sprain. Joints distal to ankle give additional mobility to foot and so on. So that is the end of our discussion for the musculoskeletal assessment. Yan. Question. Do you have any question?